go forward. Just a wonderful group of reliable, skilled, and compassionate people here serving here in Hamilton. On the case front, we're now at 20,171 cases here in Hamilton, just 45 more since yesterday. So we are still sitting at about 114 cases as our weekly number of cases per 100,000, which is just above the 100,000 mark. And our weekly number of, or our 7-day moving average of cases is just below the 100,000 mark, or 100 mark at 98. So that is good to see those numbers coming down. We're at a bit of a shoulder again. We keep doing this as our numbers come down, where they sort of pause and then fall a little bit more and fall a little bit more. So hopefully we'll continue to see a more rapid drop in the number of cases with people following the things they need to do, but taking on some additional safe activities outdoors over the coming days. The variants continue to play a very strong role for us, now sitting at about 73% of our cases having a mutation or variant of concern over the last 7 days. In terms of outbreaks, these continue to be at a high level, with 41 outbreaks ongoing at the moment. One new outbreak is reported today at Food Basics on Barton Street. And so, again, while they're moving in the right direction, it is really important that we continue to remain vigilant as we go forward, make sure we're still following public health measures, whether or not we're vaccinated, in order to keep both ourselves, our loved ones, and our community safe, and keep those numbers going down so we can continue to move forward with reopening. On the vaccine front, as of today, we have locally administered 290,000 vaccines, with an estimated 57% of the population in Hamilton 18 and over having received vaccines. We continue to see a stable and reliable supply of vaccines and a number of available appointments locally, which is very encouraging. So they are available, and as you saw over the weekend, they are now open to those who are 12 years of age and older at the time of vaccination to book into an appointment for a Pfizer COVID-19 vaccine. This expansion, of course, came earlier than was expected. It wasn't expected to happen until next Monday, and so a week earlier is good news here. Nonetheless, we'll also be working still with our local school boards to undertake some family-friendly vaccination clinics during that June 14th and 21st weeks, and making sure that there are lots of opportunities for the youth to be vaccinated, including those youth who have special needs, more complex needs. We'll make sure that there's an environment where they can come forward and be vaccinated. On the AstraZeneca front, you'll know that the government made the decision to go ahead for a limited time to allow those roughly 1,900 individuals aged 60 to 64 here in Hamilton who got their first dose of AstraZeneca during the period of March 10th to March 19th at a primary care clinic in Hamilton. They can come forward for an earlier dose of vaccine at the 10-week mark. And anybody who is part of that group that was vaccinated that week can reach out to their primary care provider, the person who gave them their first dose of AstraZeneca, ask them any questions, ask them for any information about options. This is something they do need to do with their primary care provider and not through the public health hotline. In terms of our local vaccine clinic options, you'll continue to see our large-scale clinics, our primary care and mobile pop-up clinics, all listed at the city's webpage at www.hamilton.ca/vaccine booking. And we do encourage everyone to book through the hotline, book through online through the province's booking tool rather than call our hotline if they at all can. With that, over to you, Mr. Mayor.
Thank you to our distinguished citizens, Elizabeth and Paul, and for all that great information. And to all of our residents out there, thank you for your dedication to staying the course. Again, we know this has been extremely difficult and still continues to be difficult for many people, especially if you're in retail and small businesses or restaurants. The challenges are still there, and hopefully we can get to a place where we can start safely opening those issues up. The most important issue now is for people to get vaccinated. And knowing that just about everyone is eligible to get a vaccine at this point, the best thing you can do protect yourself, for your loved ones, or for your community to get us to a better place is to get vaccinated. And so please do your best to look at all the eligibility opportunities for you. And where you can get vaccinated, how you can book. You can continue to look at our websites to get all of that information to ensure that you're getting your vaccination as soon as possible. So thank you for doing that, and continue to look after one another in terms of physical distancing is still important. Staying home as much as you can is still important. And I know we all want to enjoy the outdoors and we want to do it safely. Those tennis courts, those golf courses, the pickleball courts are all, bubbling with activity, but there is still a need to maintain that physical separation so that we don't encourage the spread of this virus. So enjoy them all, but please do so safely. So on that note, I'm going to turn it over to Jasmine, who I'm sure will lead us through some questions from the media. Jasmine?
Great, thank you, Mr. Mayor. We have 4 media joining us today. As usual, we'll start with one question and one follow-up for everybody. First question will be to Voisa from the Hamilton Spectator. Voisa, you can go ahead.
Thank you, Jasmine. My first question is for Paul. Can you describe the size of the birthday parties and gatherings over the weekend? Like how many people approximately were present at these gatherings and how many tickets were handed out?
Ticket numbers I may have for you here. Yeah, so we handed out 7 charges. That doesn't mean that's an indication of how many people were there. I don't have the sizes of the gatherings, and we can follow up with Emily, but we ended up playing 7 charges.
Thank you for that. This follow-up is also for you, but open to the floor if there's additional feedback from the mayor and Dr. Richardson. As we head into the summer and local tourism, season ramps up, are there any changes that you're eyeing compared to last summer from an operational standpoint, or any other programs like expanding the outdoor dining district, or just kind of like a preview of planning for tourism this summer?
So I'll certainly start, and then see if the mayor, who's been leading, of course, our economic task force, and there's a number of things that are included there. But first and foremost, we were aggressive in terms of the outdoor dining for this year, did that really in an upfront capacity, and we want to encourage the ability for outdoor dining as much as possible. We know that that's not going to be possible for every single business. They may not all have access to space, but wherever possible, we're doing that. And that could be through road closures, that could be through expansion into parking spaces and all the rest. So that program well underway. In fact, as you know, we fast-tracked the applications so that when outdoor dining was, or when dining was opened up previously before the stay-at-home order, we were actually ready to go. So that is a relatively straightforward piece that can happen. I think the really interesting piece that we're waiting upon is the limitations that will be placed on certain outdoor events. So there is the expectation that as we move into step 3 and recognize that given the notional timing that's there, that's the end of July, is that there are larger outdoor gatherings. Now, right now it's simply termed larger outdoor gatherings. Is that, 30 people, 40 people? Is that 100 people? Is that, I doubt it's 25, 30,000 people, but you get the point. We don't know where that goes. And I think that will have a very different impact this year than last year. Last year, really, there weren't events happening. And most of them had to shut down. This year, I think there's going to be an effort by the province to allow some of those smaller events to occur. And so I think that's the big piece that we're going to wait on. And I have been encouraging in the conversations I've had with ministry personnel provincially that get laid out fairly early. This can't be something that's done the last few days, because that will be too late. So if there are some senses about the size and scope of those events, it would be important to know that as soon as possible. And I think that could be an added piece that comes in this summer that wasn't there potentially last summer. The risk of having more people at these events is a little lower perhaps this summer, given the vaccine strategy that's rolling out and everything else we know about this virus now. So that would be one big hope, I think, for many people, is that some of these smaller to medium-sized events may actually be able to go forward this year, whereas that was not the case in previous years. Outside of that, of course, encouraging the retail opening and for people to be safe and have clear guidelines around it. But I think that will generally take care of itself. That's for businesses to make sure that they're up on the latest regulations. So I really see that event piece being so critical to it. And if we can do our work well, perhaps the size of these events this summer can be a little bit different than it was last year. Mr. Mayor, did you want to add anything?
No, I would encourage people on the retail side to continue to do online shopping local as much as possible. We did provide additional resources for the BIAs to continue to promote their businesses in their local BIAs, and I think that's going to be important. We do know that the Conservation Authority actually decided to shutter the wave pool this year, and I don't imagine, largely because these large facilities need a fair bit of lead time to actually get them up and running. You can't just flip a switch. You need to train people and get them organized. And I know that starts, literally months ago if they were to, be able to open that facility up. So some of those larger facilities, I think, are going to continue to be a challenge. And some of the larger events that we might enjoy, the major festivals, may or may not, be in a position to continue to operate this year as well because of the size of the numbers of gatherings of people that are going to happen and the amount of organizing that it requires to get these events going. Many of them, start organizing next year for the last event they had like days after they finished, and so it is a large organizational issue, and I think that becomes a bit of a challenge. But for the smaller to medium-sized events, I'm hopeful that we can see something a little bit more positive this year than we had last year.
Great, thank you, Mr. Mayor. Next question will be to Christine Rankin from CBC Hamilton. Christine, you can go ahead.
Great, thanks for taking my questions. This first one is for Dr. Richardson. And I'm wondering how much impact you think the long weekend has had on the recent declining cases, and what chances there might just be a wave of people who are waiting out the weekend to get tested today.
Thanks, Christine. I think this is always the concern as we go forward is just, will people go further than the reopening that is being allowed under the provincial guidance? And so, Paul spoke to this earlier where it's, this is how far we're going right now, and please don't go any further than that. And so that is a concern. We know pandemic fatigue is a very real thing. And these parties that were talked about that our MLE colleagues were enforcing around are a part of that and part of not following that guidance. So we certainly hope that was a protected experience over the weekend, that people did that were allowed and got together with just a couple of people outside rather than doing anything more than that. As we do go forward, this is what we absolutely do follow the guidance, because if they don't, we're going to have a longer time period to this reopening than we would like. And I think for all of us, we'd like those numbers to be down. We don't want to see our friends, our people in our community ending up in hospital, ending up in the ICUs like we have done over the last several months. And we want to see everybody getting back to being able to do the things we're doing. And vaccinations are going to be a key part of that. So as we go forward, we do have a lot more openings. We have a lot more eye on supply. We really encourage people to have a good look at those vaccines, to make sure they're comfortable with them, ask the questions they need to know, and come out and get vaccinated.
Great, thanks so much. And my follow-up is also for you, Dr. Richardson. And I know that last week you mentioned at some point people were showing up and perhaps turning down vaccines depending on which one it was. And so I'm wondering whether you can touch on if that continues to be a problem.
Thanks, Christine. I haven't had an update on that piece as of yet. We did change our tactics a little bit at the end of last week, which you may have noticed, and announced which vaccine it was that was being used in one of our clinics that was run over the weekend by our primary care colleagues, and announced that it's a Moderna clinic so that people were aware of what vaccine was being used in that site. If they wanted to look at something different, then they could not book into that and look for a different locale. But people who are coming out to the clinic would be aware of what it was, and then we wouldn't end up with vaccine appointments where no vaccine was ending up in somebody's arm. So far it's been more that we've changed our tactics, but we'll keep monitoring to see what it looks like going forward.
Thank you, Dr. Richardson. Our next question is to Manisa from CHCH. Manisa, you can go ahead.
So far with numbers opening up, appointments opening up, we have about 1,000 of those 12 to 17 that have already been vaccinated, which is great. Many of them would have been kids that were able to be vaccinated because they actually had a high-risk medical condition. And so there was already an exemption in place that if kids had those same kind of high-risk medical conditions, they could be vaccinated in those circumstances. So many of those early 12 to 17-year-old youth would have been in that group. We've got about 6,400 youth that booked in to be vaccinated over the coming week or so. So very encouraged by that. There's about 37,000 youth that are in that age group that are now eligible for vaccination. So that's a great start in terms of getting people booked into to be vaccinated. Thanks. On that front, that's just being finalized in terms of exactly where it's going to be. And so we do expect those details in the next day or two.
Great. Thank you, Dr. Richardson. Next question is to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. My first question is for Dr. Richardson. Dr. Richardson, you talked a bit today about how people with AstraZeneca can start getting that second dose after 10 weeks. And I listened to another provincial press conference today where the province has been a bit confusing on this, that they've said that it's the timing is best after 12 weeks and that it works best after 12 weeks, but that it's okay after 10 weeks to get it, but you should wait till 12 weeks, but it's okay to get it at 10 weeks. It's been very confusing. Can you talk a little bit about, what is the best timeline to get that AstraZeneca vaccine and what message you want to get out to people?
Thanks, Joanna. What we understand from the science so far is that 12-week time interval probably is the ideal one in terms of getting vaccinated with a second dose of AstraZeneca. Nonetheless, beginning at that 10-week mark, it does provide a pretty good vaccination coverage compared to the 12-week mark. So it is a little less, not a huge amount of difference. And so for people who are really interested in getting their second dose early, that's why that option is being made available to them through this particular program. But it's also why we really want to make sure that people have a discussion with their primary care provider about what's best for them. We certainly know there's people who may have a health condition for whom they need to have one in a particular time frame, and earlier works better for them, or there may be other circumstances where earlier does work better for some people. And so we do encourage people to have that discussion with their primary care provider who provided them with their first dose, and then they can make the best decision that's right for them.
Thanks so much. And my second question is also for you, Dr. Richardson. Ontario has had its first death that's been potentially, in someone who had VITT. That was announced today, unfortunately. And I'm sure this will be in the minds of those deciding whether to have AstraZeneca as their, second dose. Can you talk a bit about, what messages you would like to get out and how, what the risks are for people when it comes to their second dose of AstraZeneca?
Yeah, thanks, Joanna. So, VITT is a very unfortunate consequence that occasionally, very rarely actually happens after a first dose of AstraZeneca, and even more so rarely after a second dose of AstraZeneca. So it is a rare thing. In fact, these kinds of clots do, of course, happen for other reasons. And an AstraZeneca vaccine is actually much rarer than things that are associated with things like birth control pills and those sorts of risks for blood clots. So it is certainly something to think about, to talk through with your primary care provider about what might be best for you and are you at any higher risk for one reason or another, and then make a decision about what works best for you.
Great. Thank you, Dr. Richardson. We do have a bit more time, so we will go through again for one more question for everyone. So first, we'll go back to Voisa. If you'd like another question, you can go ahead.
Thank you so much. At the top of the briefing, the mayor listed off a few outdoor amenities that were reopened on the weekend by staff, including splash pads and tennis courts. The Hamilton Drive-In Theatre has been unhappy with being kept closed by the province. So from the mayor and Dr. Richardson, what's your message to the drive-in theater operators who are questioning why they're not able to reopen ahead of the mid-June at the earliest deadline?
So you know what, I'm certainly aligned to what the science table is saying about what should and should not open. I might have a personal view, but it doesn't seem to me that drive-ins, unto themselves are a particular problem. But there are occasions where people use the bathroom and go to the snack bar or the place where the main facility is, and could encourage them to gather. So I suspect the province is looking at those issues and wondering how they could prevent those kinds of gatherings to happen when they're in drive-ins. But you know what, we're all hoping that as the case counts go down, that a lot of these other facilities will be able to open, including theaters and concert venues. Places where people can gather and enjoy entertainment and music, and so music and theater. As we see the case counts going down, and as we are looking at additional opportunities to open things up, I'm sure drive-ins will be probably at the top of the list in terms of areas that can be considered first rather than at the bottom of the list. So I would encourage the province to continue to do a safe reopening. One of the messages we delivered today as the Greater Toronto Hamilton area mayors is that we don't open things too soon. I mean, we saw the impacts of that not too long ago when the case counts weren't particularly low, and we opened up some restaurants, and a week later we had to close them all down again because the case counts took a spike. And so I think it's a wait and see in terms of the numbers. I would certainly follow the numbers and follow the good advice of our scientific tables to determine whether or not these kinds of facilities can open up in the near future.
Great, thank you. We'll go next to Christine Rankin. Christine, if you'd like another question, you can go ahead.
Sure, thanks so much. I believe this will be either for Paul Johnson or Mayor Eisenberger. The COVID-19 virtual memorial wall is up, and there's already a few entries. And I'm wondering if you can speak on any feedback you've heard from the community on this.
Personally, I haven't heard anything as yet, Christine. I do think for a lot of people, it's a great opportunity for them if they're interested to respect and memorialize their loved ones, and it's part of the kind of memorialization of this pandemic and the impacts it's had on the lives of many people. Whether they've died from the pandemic or whether they are still suffering from the ill effects of the long haul symptoms that are still quite evident in many people that have survived the pandemic. And so I haven't heard any direct feedback. I do know that anecdotally I think people think this is a good idea. Certainly council does, and our staff do. And as I said in the media previously, at some point, once we're past this pandemic, I think a more physical representation of this pandemic and the lives that were lost is probably something that we want to consider seriously. So to date, I've not heard anything negative about the memorial wall, and I'm glad to hear that some individuals have taken up the opportunity to memorialize their loved ones on the virtual memorial wall as it is right now.
Great, thank you, Mr. Mayor. And then we'll go back to Manisa from CHCH. Manisa, if you'd like another question, you can go ahead.
So we've taken the approach that we're turning on the ones that fill bottles. We have some fountains in the city that are the bubblers. So very little stream of water coming up. It literally just bubbles out there. And because of the inability for us to clean, as often as we would need to with those, the bubblers are not in our plans at the moment, but if they're not on already, we will be turning on the fountains that both fill water bottles, and some of them actually have a dual feature that allows some water for pets as well that are there. So there will be some fountains available, but they will be confined to those that are more the bottle fill variety with a stream of water coming, not the bubbler variety, which do exist in some of our parks and other areas.
Thanks, Paul. Next question will be back to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the extra question. My question is for Dr. Richardson. Dr. Richardson, I'm looking to find out if there's any details yet of the family clinics that are supposed to be taking place in the middle of June. And students who have been booking through the provincial portal aren't getting their second dose by that August 22nd date. So also looking to find out whether that matters or what that means.
Thanks very much, Joanna. The family still being worked out with the province, and bookings will go forward around those. So we're waiting to hear details from our colleagues at the provincial level as we're working through the provincial portal. The time frame for the second doses for youth, you're right. At present, anybody who's booking right now will get that 4-week time interval that everybody gets. If there will be a change to that, a change with the system in terms of rebooking those second doses, and that's going to come in the next couple of weeks from the province, and then they'll be able to work to book them in at the shorter interval. So again, that's another piece where we're just waiting for the province to finish off with their technological solutions for those.
Great, thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today, so I'll pass things back to you.
Thank you very much, and thank you, Bill Custers and the entire team at Cable 14 and Clear Cable for helping us with these media advisories. Your work is always appreciated because they go so smoothly. Folks, please do your part and stay close to home as much as possible while we're under this stay-at-home order. I know that's more challenging as the weather is nice and everybody wants to get up and around, but if you do get up and around, do it safely. Think about the masking and the physical distancing. That's still important, whether you've been vaccinated or not. We're not yet clear of this COVID virus, and that will be some time to come yet while we get more people vaccinated to hopefully get to that point where we can relax those very unfortunate and stringent requirements. So if you can, please shop local as well as much as possible. Visit our BIA's webpage or our hometownhub.ca to connect with and support our amazing business community. And as always, for more information on COVID-19, the financial supports or any other updates on vaccines, you can go to hamilton.ca/coronavirus and get all the information there that I think you will need to work our way through our COVID-19 experience here in the city of Hamilton. So please continue to do all the good public health measure work, help stop the spread of this virus, get the vaccine when you're eligible, and now just about everybody's eligible. And so let's continue to do what we need to do to get our community back into some sense of normalcy, hopefully as soon as possible. In the meantime, we're going to be back here on Monday, May the 31st at 3 p.m. for another media update. Look after yourselves, be kind to one another, be patient with all of our staff that are working to vaccinate and help us work through this pandemic effort. And we will see you next time for the next media advisory. Thank you.